Hey there, Christie Fleetwood back with you for another installment of this book, Diseases of the Drugs in Hypertension, Dyslipidemia, and Type 2 Diabetes. We're picking up on page 44, just in case you wanted to follow along in your own copy. So, last video, I was telling you about the other drugs that you might have been taking for some other reason that could drive up your blood pressure to the point of being diagnosed with hypertension. And hey, let's offer you medical management without providing the risks along with the benefits and not telling you about any alternatives. To keep these videos short, I'm just going to focus on diseases of the drugs, my alliterative way of saying iatrogenesis. So, once you are diagnosed with high blood pressure, you could be put on any of these medications to manage your numbers. It's not going to stop the progress of the disease. Otherwise, we wouldn't have such a heavily medicated culture here in this country and still have cardiovascular disease as the number 1 or number 2 killer in the US every year. It alternates with cancer back and forth. Iatrogenesis might actually be the highest killer. I can't make this stuff up. So perhaps you're put on a diuretic just to pull fluid off of your vasculature and thereby lower your blood pressure numbers. You might be put on a thiazide diuretic, which will deplete a bunch of nutrients. And we'll talk about that with the next installment. So I'm going to focus on the precautions and the boxed warnings. Good news and bad news here. The good news is there aren't many boxed warnings for antihypertensive medications. We're going to see a lot of those when we look at the drugs used to manage type 2 diabetes. But for this, looking at the thiazide diuretics and not paying close attention right now to the nutrients that are depleted because they waste a lot. Because of the loss of sodium and potassium, there can be hypovolemia. That means you don't have enough volume in your vessels, your blood vessels, and you can pass out. Wow. But these drugs, the thiazides, tend to, according to the manufacturer, uncover latent diabetes, meaning you were bound to get type 2 diabetes anyway. This drug just uncovered it faster for you. What? Other things that can happen, loss of vision because of glaucoma, myopia, choroidal effusion. There can be activation or exacerbation of systemic lupus erythematosus. This is an autoimmune condition, but I want you to catch it. It could be an exacerbation, like you already had it, and this just is making it worse. Or it could be activation, meaning maybe you had it and you just didn't know it until you started taking this drug. Dude, it's like saying latent diabetes may become manifest. The drug causes it. Wowza. Wow. Avoid taking this with lithium because it's wasting CoQ10, magnesium, potassium, calcium, sodium, zinc, vitamin D. Many of those, not all, but many of those that I just listed are bivalent, which means when you put lithium in the mix and you're sweating a lot, or you've got a drug that you're taking that's wasting your normal electrolytes, then the lithium gets to dock in all those places where you just lost magnesium or potassium or calcium or sodium or zinc. What? And don't interchange. If you started on a brand and then you're switched to a generic, stick with the generic for that brand, not a generic for a different brand, because not all of the generics are going to be quite the same. That's a whole nother conversation. What if you're not put on a thiazide, but rather a potassium-sparing diuretic? Oh, because this last group wasted potassium. Well, Don't use these in Addison's, which is a cortisone problem. Avoid in the diabetics and patients with severe kidney disease. Avoid in severe kidney or liver disease if you're on triamterene. Triamterene can cause dangerously high potassium. Potassium is a nutrient that has a very, very narrow therapeutic range. The numbers for potassium need to land between 4.0 and 4.5. That's not a lot of leeway on either side. If it goes below 4 or over 4.5, you can have arrhythmias. You can have blood pressure issues. So the first line of treatment for high blood pressure, after you've checked your medicine cabinet to see if you've taken something that would have caused your high blood pressure issue, the second thing is to get your potassium checked. If you're low or high in potassium, then you need to get the level of that nutrient where it's supposed to be in your blood. What if it's a loop diuretic? Well, those can cause ear damage, hearing loss. Bumetanide has a boxed warning for causing profound diuresis. Now, most people are started on bumetanide in the hospital and then switched over from the IV version to the oral version. This can worsen kidney function, worsen electrolyte imbalances, and you may or may not get your hearing back if you come off these meds. A different class would be the alpha drugs, alpha 2 agonists and alpha 1 antagonists. Even though they've got different numbers after them and different modifiers, one's a potentiator, one's a blocker, but the overall effect is that there's going to be a reduction of your blood pressure number because of vascular pooling. It means you might have some edema when you start on one of these, meaning a little bit of swelling in the lower limbs. This is stopping the docking in of norepinephrine, but typically in the extremities. Now, these used to be dosed, the first dose, in the medical doctor's office. That's not happening anymore, which is a shame because this can cause such a dramatic lowering of blood pressure with the first dose. There's a law of dual effect at work here. Also, another topic for another day. But the first dose of a drug brings about the biggest reduction in whatever we're trying to reduce. So with blood pressure, we're trying to get the blood pressure number down. After that first dose, your body's still trying to get the message through to you, and the drug is telling it, shut up. And the body keeps pushing, and the drug tells it to shut up. So these typically are used more in our kids, at least the alpha 2 agonists tend to be used in our children more so than adults any longer. They've been repurposed for ADD, ADHD. Same dose for the skinny little 7-year-old as the overweight 55-year-old with high blood pressure. Beta blockers is another class of drug. Got a bunch of them listed here for you. Their generic names and their brand names. Some of these are more selective for the heart than others. The ones that are not so selective for the heart tend to have a more of an adverse effect on the lungs because the heart and the lungs are so intimately intertwined. It's hard with a pharmaceutical to touch one for a positive benefit and not cause a negative problem to the other. There are some boxed warnings, like Sotalol gets the boxed warning for causing atrial fibrillation and ventricular tachycardia. What? Yeah. Yep. It's used to treat atrial fibrillation, but it can cause atrial fib. I know. It's a little bit of a circular thought that starts going through your head when you begin to understand what's going on with these medications. This one that has a little plus mark by it is betoxolol. It has a quinidine-like or anesthetic-like action in the body. Never, never, never stop these cold turkey. Same thing with the alpha drugs. They have to be very slowly tapered off just like they're kind of ramped up in the front end, they get tapered off in the back end. Same thing with the beta blockers. Because if you pull those drugs too fast and allow all the norepinephrine to dock into the alpha or beta receptors, blood pressure jumps up. Calcium channel blockers. By the way, the mechanism of action is not clearly understood for most of these drugs, even though they have names that sound like the scientists know exactly how they function in the human body. But the calcium channel blockers have warnings around causing chest pain, causing myocardial infarction, heart attack. Now, for people who really do need to be medicated while they're getting the lifestyle in order, this is a better option for people who are Black. And when the manufacturer's they don't say African American Black people versus Indian Black people. I mean, I've got Indian friends who are blacker, pigment-wise, than my African American friends. But just take that with, just understand that there are ethnicities that aren't going to be served as well by some drugs as by others. Same thing with gender. And then if there's a really high, like you've got this acute jump in your already high blood pressure, don't use Procardia for that. Or for the control of essential hypertension, nor within the first week or two after a heart attack. They should be avoided in the setting of acute coronary syndrome because there could be a heart attack coming. Well, that's a whole lot of things that you're supposed to know that are not until the future. So it's a little tricksy to know when to give somebody some Procardia. And I want to draw your attention to this. Don't use this for the control of essential hypertension. 95% of the people being diagnosed with hypertension, it's essential. What does that even mean? Many of these products do contain polyethylene glycol as well as parabens and colorants and corn and pork and talc and magnesium stearate. That's actually table 4, so I'll save that for later. Monitor the potassium in all of these because some will jack up the potassium while some will deplete the potassium. We can't tell, and that's why you've got to get your blood taken. Angiotensin converting enzymes, or ACE inhibitors, and their angiotensin receptor blocker cousins, the ARBs, I'm going to cover all in one fell swoop. They tend to deplete sodium and zinc and increase potassium. They have the boxed warning for fetal and neonatal morbidity and mortality. It means they can kill a baby. These should not be given to women of reproductive age. They can cause malignancies and renal failure. When I started teaching pharmacology back in 2013, there had just been this new study that said, hey, ACE inhibitors, which are fairly new on the market back then, these ought to be the first line of therapy because so many people with high blood pressure are going to develop kidney issues secondary to the high blood pressure and or type 2 diabetes, and the wonky cholesterol comes in the mix. And so practitioners have learned to prescribe ACE inhibitors kind of first line. But all of that protects the kidney information has gone away because now we know that these drugs can cause kidney injury. They can cause acute kidney failure. They raise the potassium to a dangerous position. They interfere with the health of the blood. They can cause liver failure, and these are less beneficial in Black patients, but with a greater risk of the angioedema, which is what causes that dry, hacky cough, and swelling in the ankles. So it's really a lousy drug for women of reproductive years, Black people, whatever that really means by the drug manufacturer. I would cover darkly pigmented people and African American or African descent folks just to be safe. But this is also lousy if your job depends on your vocal quality, because 20% of the people who take an ACE inhibitor will have that cough, which is very problematic when it's your voice that's your living. The cough issue is a little bit less of a problem with the ARBs, and that's really the only benefit that they provide. Now, I am taking this right off of the website where you can get your own copy of this 2-in-1 book, Diseases of the Drugs on one side, flip it over for disease reversal, and I'll bring you story time with Fleetwood about that later. But if you're interested in having your own copy of the book, the way to get that is to go to the website ChristieFleetwood.com, ChristieFleetwood.com. Then from there, you can buy it from Amazon, Barnes & Noble, Ingram Spark, or directly from me. And if you're like, hey, I'd like to not have high blood pressure any longer. How do I do the disease reversal? I don't want to wait until you start having story time with Fleetwood with disease reversal. Fine. Go to thediseasereversalproject.com. Start about episode 4 and actually do what I'm asking you to do. Please don't binge watch. It's not a Netflix kind of thing. And if you've already tried some things and you just need some help and you want to work with me, that website is monarchnaturalmedicine.com. All right, there's the information. I'll be back with more for you later.